Body feminization for gender-affirming surgery. It includes full body lipo, narrowing of the waist with both lipo ribs, expansion of the hips and buttock. This patient had a previous breast augmentation with me, and she's now coming in for a second part of her body contouring. All right, body feminization, bringing in the waist with both lipo and rib remodeling, and then expansion of the thigh to create more of an hourglass effect. Gender-affirming surgery, we're going to be doing liposuction of the upper back, mid-back, waist. Something, when patients are online looking at videos, a lot of times they want to see other patients that look like them, and I think that's a really, it's a good strategy, so you have realistic expectations. This particular patient has a little bit more fullness and around the hip roll and waist area, as you can see on the preoperative photo. So really the trick here is going to be to really contour this down, create a smooth, gentle curve. We're going to rib remodel the 9th, 10th, and 11th rib. Her 12th rib is a little bit hypoplastic or short, so there's some technicalities. If the rib is too short, sometimes we can't treat it, because if it's like this short, then it won't make a difference, plus it's too deep to access. So the point is, rib remodeling, depending on the CAT scan, we determine which ribs we treat. Lipoing this area to really create that dramatic contour hourglass effect, and then expansion of the buttock and hips. The next portion of the procedure is rib remodeling, so we're going to take it through the steps. First step is I manually palpate or draw out the ribs. Step 2 is confirming the markings with ultrasound. Step 3 is going to be infiltrating local or numbing anesthetic. Step 4 is going to be actually doing the microfracture. Then step 5 is when we actually do the green stick fracture. So let's take you through the steps. I've drawn out the ribs. This is just kind of an external map. Topography, which is the surface anatomy, is the technical word, and then we take the ultrasound, and then I confirm. See that? That's a rib. So I confirm that my markings are correct by finding it with the right there. That's the rib. My finger's pushing down on the rib, so I know that I'm in the right place. There's another rib. There's another rib. So step 1, mark. Step 2, confirm. Step 3, I skipped this before. It's called deperiostealization. You take the needle and you just scratch the outer surface of the rib to remove a thin layer called periosteum. It's harder to microfracture the rib when the periosteal layer is intact. Step 4, this is the device. You can see it's like a needle tip, 30 millimeters in length or 3 centimeters in length. We now go through that small aperture or opening that was created by our needle. We get down to the bone. Once we get down to the bone, we use a pedal to activate the device. So right now I'm on the bone. I can feel I'm on the bone. And what I'm doing is kind of with that needle tip making these little small microfractures. which then allow the outer cortex or the outer layer of the bone to be fractured at an angulation. After we use the piezotome and we create weakness in the outer table of the bone, we simply... So after we do that, what you can see here is this. So I'm going to push down. It's really, really nice. You could see with the marking how that, you see where the marking is? It's like it really shows you how much of a difference that makes with the angulation of the ribs. So when you break the bone, it's a monocortical fracture, meaning just the upper part's broken, but the part on the bottom is still intact. So it creates an angulation. When you heal, if you don't wear the garment, it's going to go back to this, right, straight. What you want to do is heal while the bone is angulated. That angulation is what allows the angulation right here to bring in, is what allows the waistline to narrow. That angulation is maintained by wearing the corset. We finished performing the rib remodeling, and now what we're going to do is confirm that there's no pneumothorax. Our anesthesiologist, Michael Sliff, is going to give us a demonstration of, on ultrasound, why there's no pneumo right now.
So here we're looking at approximately like the T4-5 level, and this is rib right here, so you can see that higher arc there. This is the intercostal space. This means the space between the ribs. And right here, if you hold the probe really, really still, you can see there's a white line right here. So that's actually the pleura, which is the lining of the lung cavity. And you can see with each breath that the patient's taking on the ventilator, the lung is expanding and contracting, and that's that sliding of this line all the way across. Same thing right here. If you can see this lung sliding all the way across with every breath, you know that you have a fully expanded lung, no air in the cavity, no collapsed lung.
Can you explain the dots and as a reference point in terms of centimeters, how deep they are?
The dots over here, you can actually see, not every ultrasound machine has like the actual measurement down here, but typically speaking, the bold dots are either a centimeter or a half centimeter depending on the depth. So we have this set to 4 centimeters. Each one of these dots is 1 centimeter. So you're looking at a depth, the lung is about 2 centimeters below the surface of the skin right here. So the rib starts at about 1. You have another centimeter in that intercostal space of depth. This is intercostal muscle right here. And then below that is the lung.
All right, so we showed you, we took you through the steps of rib remodeling. You can see really nice improvement in the hourglass, waistline, expansion of the hip. So the combination of a waist to hip ratio, that really determines the degree, or it's an objective standard for femininity. Small the waist, wider the hips, smaller the fraction, the more hourglass the effect. So you can see nice improvement in the hourglass effect. We brought in the ribs. She was very, very tight here, so we did not get a lot of expansion, but I did get as much as I could, and most of the magic is in the waistline. Recap: gender-affirming surgery, body feminization, including both lipo, rib remodeling with fat transfer to buttock and thighs. We took you through the steps of rib remodeling. A simple way to think about it is that it really overcomes the limits of lipo by remodeling or infracture in the bone to reduce the total circumference of the waist. On average is about 2 to 3 inches in reduction just from the bony work alone. Patients wear a corset for about 3 months. Otherwise, the recovery is standard for lipo. All right, 1 week follow-up, patient had gender-affirming surgery, body feminization, which included full body lipo, ribs, fat transfer to buttock and hips. Now, I know she's in a garment, I know she's in a corset, so the point of this is not to say, look at the garment and corset. The point of this is to say, look, it's 1 week post. YouTube doesn't allow us to show full body nudity or exposed body. So what I want you to really get is the shaping and the concept and not focus so much on the garment. It takes away from the message. So you can see there's a very nice dip here that is unattainable without ribs. So ribs really overcomes the limits of lipo. And when she's like 2-3 months post, we'll have her do something like flattering clothes where there's no corset, but for now we prefer to maintain the corset 24/7. So I'll have the patient turn a little bit, so you could turn a little bit. And she came from the East Coast, she came from Boston. And you can stop there. So she came from Boston. This is going to come in a little bit more over time. I worked on ribs 12, 11, and 10. I am offering now some stage approaches in the future, or we could do maybe 8 and 9s. A lot of people have questions about that, but for now I'm staging it. She has great projection in the buttock, maximum hip expansion, so overall she's doing great. And she's going back home to Boston in a couple days, so she's here for a week, and everything's good. Thanks so much for watching. If you enjoyed the video, drop us a comment, give us a like, subscribe. I'll see you in the next one.